Hi, Dr. Greg Pat here again. Today we're going to talk about if you have back pain when you're standing and walking. So as a physical therapist, one of the biggest complaints we often hear is that people have lower back pain when they're standing and walking. So a lot of times you can hear the term stenosis, arthritis, degenerative disc disease. Oftentimes these three conditions can lead to back pain when you're standing or walking. So I'm going to show you a little bit about why and kind of what's going on. So first what we want to talk about, I'm going to draw on the board, is some of your lumbar vertebrae. So these bones here, this would be a vertebrae. We'll just call it L4, and we'll call this L5. So you have 5 lumbar vertebrae, L1 being at the top, L5 being at the bottom before you get into your sacrum. Between the vertebrae, this is your disc, and then between the vertebrae you have this hole where the nerve comes out. So what happens as we get older, especially over the age of 50, these conditions, degenerative disc disease, stenosis, arthritis, start kind of acting up. So normally, again, what happens, you have this disc, creates a nice big space between the vertebrae. You have this nice big hole where that nerve can come out. These bumps here would be the bumps you feel along the spine. This mono would look like this. This is more towards the front of the body. The stomach would be out here, and this is the back. So you have this disc, creates that hole where that nerve can come out, and there's no issue, no problems. You can stand and walk, feel fine. What happens as we age, though, I assume anybody watching this video that's over the age of 50 has not gotten taller, and hasn't gotten older. What happens is you start to shrink. Some of that comes from this disc starts to lose some of its height. So now instead of being this big, now say the vertebrae come here, and now the disc has kind of degenerated. It's starting to narrow down, that degenerative disc disease. That disc starts to narrow. So now instead of that nice, really big hole where that nerve to travel out, now you have a much smaller hole where that nerve travels through. So a narrowing of that hole, what they call the hole is called the foramen. A narrowing of that foramen is called a stenosis. Stenosis means narrowing. So how does this relate to pain when you're standing and walking? So what happens is as you stand and you're upright, your spine is more extended, and this hole starts to narrow down kind of even more. As you sit, so a lot of times I can walk a mile, and then if I sit down for a couple minutes, I can get up and continue to walk. What happens is as you sit, your spine kind of flexes forward, it flexes, and that kind of opens up this space where that nerve travels out. So it kind of decompresses that nerve, takes that pressure off, relieves that lower back pain. So when you're standing and walking, your spine is more extended, there's more pressure, more narrowing, more pressure on that nerve, giving you the back pain. Oftentimes you hear about this if somebody's going to the grocery store and they say, oh, I can only walk 10 minutes. And I say, well, what about when you go to the grocery store? And they say, oh, I can walk 30 minutes around the grocery store, no problem, as long as they have the cart. Why? Because as you have that shopping cart, you're kind of flexed forward, you're leaning forward, that opens up that space, relieves that pressure on that nerve. So what does physical therapy do for this? There's a lot of stretches, mobility, there's traction, a bunch of different things that we can kind of talk about, but I recommend seeing a physical therapist. If you are having pain when you're standing and walking, it's usually a condition called degenerative disc disease, arthritis, or stenosis. They all three kind of are talking similar things. and physical therapy is usually very beneficial, usually one of the most common things that we see. That's kind of what it looks like, is because as you get older, the disc starts to narrow, this hole where the nerve comes out starts to narrow. The more you stand, walk, extend, it pinches on that nerve. If you bend forward, it relieves that pressure, which is why we see people as they get older, they end up kind of getting stuck and they're always walking forward because they start to lose that mobility of going backwards, which nobody wants. So if you're having issues with this, you want to see a physical therapist, and they'll kind of get that mobility back, work on your core strength, your flexibility, get you feeling a lot better. So hope that makes a little bit more sense. In the next video, we're going to talk about if you have back pain while you're sitting, why that is.